So thank you all for joining us today. We're really excited to talk about breath. We think that this is a very under discussed topic in healthcare and even in natural health. Sometimes it's something that gets skipped over, but it is incredibly powerful. And today, some of the things that we really want you guys to walk away with are some useful tools to help your respiratory tree, to help you have better breathing and oxygenation. And we're going to talk about why that's so very, very important. So I'm Dr. Molly Force. I'm the clinical director here at Prosper Natural Health, and I'm joined by Dr. Rosalie and Dr. Mary. One of the things that I just love about our practice is that we have this combination of naturopathic medicine, which is predominantly primary care medicine from a natural standpoint. And then we also have these subspecialties within our practice of Ayurvedic medicine from Dr. Rosalie and traditional Chinese medicine and acupuncture from Dr. Mary. So it really ends up rounding out our clinical experience. And we're excited to talk about this topic today for you guys from all these different angles, these different ways of approaching natural medicine. So if you have questions that come up, please make sure that you're entering them in the chat so that we can get to those at the end. We have a lot of information to cover today, and so we're going to jump right in. Let's talk about the respiratory tree today. We want to make sure you guys understand recognizing breath imbalance and what that means for your health ultimately if breath is imbalanced. We want to make sure we talk today about ways to evaluate and measure things like environmental allergies and breathing patterns and lung capacity. And then we, of course, want to share these tangible tips with you guys so that you can walk away knowing better ways to support your respiration. One of the beautiful pieces here as naturopathic physicians is we always like to step back and look at anatomy and physiology first. We want to understand breathing and respiration from the initiation of this. And so we're going to take a moment here and go through the respiratory tree. Now, you guys can probably guess that this doesn't start with the lungs, but instead starts with the nose. So these nasal passages are very important because they restrict our airflow. And when it does this, the nostrils actually are going to warm the airflow that comes in, and it increases certain gases in our body when this happens. There's a release of nitric oxide, which we know actually helps with the antimicrobial effect that helps us clean our breath. And we also have this initiation of exchange of carbon dioxide and oxygen in the body, starting right there in the nostrils as the air flows in past these turbinates, which are separated by the midline, the septum. We have our sinuses, which are going to come into play here as we're having this conversation, and the nasopharynx behind that. Then we have the whole system of the mouth, which is going to connect here with our nasal sinuses and meet here through the larynx and vocal cords here. And we have our trachea, which runs down within the lungs. We start to get into the bronchi and then the smaller bronchioles, and then the even smaller alveoli, which is really the site that we exchange the majority of our gases in at these capillary beds, which capillaries, we like to think of them as some of the smallest vessels in the body. So we want to think about this because at any portion of those stages, we could have an imbalance. And by rebalancing the basic anatomy and physiology for our bodies, we can make a tremendous impact on our breath and our respiration, which means our exchange of gases within the body.
Okay, so next we're going to dive into allergies and the physiology behind that. So when we have, so there's a couple of different processes that are going on when people think of the word allergy. We have our frank anaphylactic reaction where someone can have their face swelling up, their lips swelling up, their throat closing, more of that kind of emergency allergy situation. And then, so we've got that one. We've got one where you can just have itchy eyes and a runny nose, and that's kind of what we think of more of an environmental allergy. And then we have more of what we think of as food intolerances. And these are all three different processes, but the first two fit into this picture to the right. So the sort of emergency style throat closing and lip swelling up, that is the anaphylactic reaction, and our environmental allergens or allergy reaction, those are two IgE related reactions. So what happens in this whole process? First, you need to be exposed to an allergen, so that you can imagine a pollen grain kind of floating through the air. You're exposed to it, and then your body, through a series of these interactions with these immune cells, you can see on the bottom here, create a whole line of cells that then create what we call antibodies. And those antibodies are those IgE antibodies. And then those attach to these other cells that we call mast cells, and they act as homing devices. So when we're re-exposed to the allergen, so that whole process happened, and then a couple of days later we have that allergen come back, then they have these kind of receptors and they're sensitized. You can see that on the right hand side there. And at that point, they release histamine. You may have heard of histamine before. That's the main inflammatory chemical that then goes to our cells and causes that increased mucus production and the red, itchy eyes and all of those reactions. So that's the basis for what we're talking about here. And you may see later on, we'll talk about the differences between IgE versus IgG reactions, that kind of more typical allergic reaction versus an intolerance. And we'll also talk about mast cells. Later, we'll talk about herbs that stabilize mast cells. And that is what we're referring to, those cells that release histamine. All right, so some key points that we are going to talk about here in relation to the pathologies of the respiratory tree are chronic sinusitis, allergies, asthma, sleep apnea, and GERD. Okay, so sinusitis. What are we talking about when we say sinusitis? So you can, as Dr. Molly was mentioning, there's many different areas that we refer to within the respiratory tract. And the sinuses are these cavities that exist behind our eyes, behind our forehead, and kind of behind our nose here. And when these get inflamed, we get increased mucus production, and sometimes they can actually kind of close up our sinuses and there's less space in there. And this eventually, that mucus production will cause a cough, we'll have nasal discharge and congestion, often a headache from that increased pressure in the sinuses, and then facial pain from that as well. And the causes of the sinusitis can be acute, so more infectious like viruses and bacteria and irritants, and also chronic in the form of allergies, so reactions to pollen or foods and various fungi that are, or especially mold spores that we encounter in the air that we breathe. All right, so the next thing to talk about is hay fever, similar to the environmental allergy sinusitis, but a little different. And hay fever happens seasonally in response to usually pollen, but also other allergens that float in the air. And you'll think of those typical signs of sneezing and nasal discharge and itchy and tearing eyes. And again, this can be from our pollens in the air. It can be from our pets. So, cat and dog allergies fall into that category. And then it can also, many people have reactions to dust and dust mites and mold. And this brings us to this interesting hygiene hypothesis. There's this idea in immunology where there's two major cell lines. One is the Th2 system, and one is the Th1 system, and they can point us either towards the allergy side of the immune reactions or towards everything else that happens. And when we have actually less exposure to bacteria and other microbes that stimulate our immune system early on, we often see higher levels of allergies. So in the Western world, for instance, where we have sterilized water and use hand sanitizer, we're seeing this increased rates of allergic reactions. So this leads to what we call the hygiene hypothesis, that by killing all these microbes, we're actually setting ourselves up for a more reactive immune system.
Thanks, Dr. Mary. Our next big pathology here in the respiratory tree is asthma, which again, we're sort of moving down the body here. We talked about, the sinuses, we talked about the nose, now we're talking about the inflammation in the lung bronchi, which are those first sort of branches from our windpipe into our lungs. And so symptoms of asthma are typically worse nighttime with stress and with cold, dry weather. We're talking wheezing, shortness of breath, cough. And the major causes of asthma include exercise-induced asthma, our allergens. Again, if you're sort of walking by and someone's leaf blowing and you get all of that in your face, it can lead to an asthma attack, right? Stress and emotions are really common for our pediatric patients in terms of bringing on an asthma attack. And then lastly, there's this piece of food sensitivities actually cross-reacting with the respiratory tree and leading to asthma-related allergy symptoms. And then additionally, moving down in the respiratory tree, we're thinking about sleep apnea. Which is another really big one that I don't want to forget about when we talk about optimizing oxygen intake. And sleep apnea is fairly common. It's something that's underdiagnosed, and symptoms include snoring, sleep disturbances, especially awakening in the night, gasping for breath. A big symptom here is excessive daytime fatigue, including sort of at the wheel, right? We're sort of driving and just so tired. And it has to do with the fact that we're not oxygenating well at night. Headaches are also a big symptom, as well as high blood pressure, curiously enough. Causes of sleep apnea are a repetitive collapse of our upper airway. So think about everything that's in the head here, from nasal and sinus congestion, leading to then mouth breathing, leading to a tongue that's kind of rolling back. Obesity in the size of your neck can contribute to sort of a collapse of that upper airway. The lower jaw being smaller means that everything's pushed back. Same thing with a large tongue contributing to sleep apnea. And lastly, when we're talking about pathologies, I really want to throw in this curveball, which is GERD. It stands for gastroesophageal reflux disease. And I bolded the big symptom here, which is chronic cough and clearing of your throat. When we think of cough, we think something's going on with the lungs, which is true, but one of the big causes of chronic cough includes just reflux of the stomach contents into that windpipe up top. It can be acid reflux, but it can also be silent. And the biggest piece that leads us to thinking about this is when it's worse with a reclining posture or after meals. Ultimately, a lot of different causes here. Incompetence of that lower esophageal sphincter, being overweight, obese, hyper or hypochlorhydria, which means high acid in the stomach, or low acid in the stomach, curiously enough, can contribute to heartburn, as well as, yet again, food sensitivities here.
So we want to talk about some different ways to identify these things, but just as a recap, essentially being able to properly respirate and getting our oxygen in is all powerful for the body. Through breath, we regulate our blood vessels, we regulate the influence of oxygen coming into our cells, and we even can regulate our congestion in our nose and our nasal passages, and also affect the airflow all the way down into the lower bases of the lungs, influencing diaphragmatic breath. So we want to make sure that what we're doing is really supporting those areas, making sure we don't have any of those common pathologies that we just went over that might be affecting us, because it really does have a ripple effect from the body. We know that when the breath is disrupted and respiration is disrupted, our risk of anxiety is much higher, our risk of insomnia and disrupted quality of sleep is much higher. And we know that we also even can have impact, we see this in children, with the development of our face and jaw. So it's pretty impactful how we breathe. So as physicians, we're always trying to look at our patients and seeing them in person or sometimes over telemed, as we've learned with the pandemic, really watching how they breathe, how they respirate while they're in front of us tells us quite a bit. You guys may have picked up when you're interacting with people, or you may even know about yourself if you're a nose breather or a mouth breather. And a lot of times in a common, in like movies and shows, they'll kind of show a not as smart person being a mouth breather. And there's a physiologic reason for this. And that's that when we have a disruption of our nasal breathing, we're not able to have as good of cognitive function. So, and that comes down to getting that oxygen into our cells appropriately. So we want to think about what kind of a breather are we? And we're looking at our patient saying, how are you breathing? We're looking physically, seeing if they have sinus pressure or anything that's blocking either nasal passageway, if they have a deviated septum. We're of course listening further down at the lungs. We want to be checking for a normal respiratory rate, which for an adult is typically around 14. We often are running our pulse oximeter, that little device that goes on your fingers when you're at the doctor's office. And we like to see those numbers somewhere above 95, if not closer to 98 or 99. We like to make sure with some of our patients that deal with COPD or asthma that we can use a little peak flow meter where they're expiring into, they're breathing out into a little tube that helps us calculate the amount of volume that they can get out to see what their lung capacity is at any given time. And then also we like to check in with our patients and just ask them, do you find yourself breathing mainly in your upper chest, or do you find yourself integrating that belly and those diaphragmatic breaths? So another really great tool for us as physicians is to be able to look and find out what is going on with the nasal passages if they are blocked, to make sure that it's not a bacteria, virus, mold, some kind of microbe that's part of that imbalance. We have really cool tools for this nowadays. One is we can either culture a sample from the nasopharyngeal area with a swab, or we can actually send those in now for DNA analysis, which is called PCR testing. And many of you have heard that now with the use of COVID testing, which is also a swab that's done. So that's that amplification of the DNA to find out, is there a microbe present or not? And this is a big deal because we work with people who've had a disruption of their nasal breathing for 20 or more years because of chronic lingering sinus infections that they have not been able to address otherwise. And if it's not a standard bacteria that really responds to something like augmentin, which is commonly given, then they can go on with these high levels of inflammatory infections for very long periods of time and not have that addressed. And that can be impacting their sleep, their mood, their energy, and their cognitive function ultimately. So this is just an example report from a culture. And what we see here is we see that this person came up with a certain type of bacteria, which happens to be a certain form of staph. What's cool about these cultures is we like to use labs here at our office that's really looking at susceptibility reports to find out what antimicrobials will work against these microbes, because so many of these microbes have found ways to become resistant to certain antimicrobials. And then we also like to run a fungal panel when we're doing this too, because fungus is another very, very challenging thing that can really set up shop in those moist environments. This next slide is going to be an example of a PCR analysis. So it tells us the amount, the percentages of these different microbes. What's cool about this is it picks up the viral components, which we just can't do without that DNA amplification. We don't get that with cultures. And then it also helps us look at resistance genes. So that helps us understand what microbes are going to work well with certain medications if they're needed. And this is the second portion of that panel, showing that all of these microbes are looked at, and that all of these are the drug resistance classes that are looked at. So the other piece that we use quite a bit when we're more concerned about things like allergies or food sensitivities influencing our inflammatory technique are blood tests. So I'm going to turn this over to Dr. Mary.
All right. So with the blood tests, we are looking at our systemic reactions to things. So rather than identifying microbes that are actually present in our nasal mucosa, we're looking at things that our bodies have created this response to. So that response can come in the form of those antibodies that we were talking about before. So either the IgE antibodies or the IgG or IgA. So those are three different types of antibodies. The IgE is associated with our typical allergic reactions, right? So the anaphylaxis and the hay fever type pictures. IgG is more associated with sensitivities. So if someone has a sensitivity to almonds, some people have sensitivities to many other things like dairy when it's not lactose intolerance. And this can cause congestion and contribute to inflammation and allergy symptoms. We often like to think of this as a bucket with using a bucket analogy. So, you have your typical allergic reaction, and then you can have all of these other reactions to foods, to allergens that are kind of adding those inflammatory cytokines or, inflammatory molecules to your system. And when that gets too high, the bucket will overflow and you'll get symptoms. So again, for the IgE allergy testing panels, we're often looking at environmental allergies, like the anaphylactic reactions to food, and then bee sting allergies, like that type of thing. And then for the IgG and IgA, we're looking for sensitivities. So here's a sample report that we can look at. So this is the difference between, so these are on top, we have the IgE reactions, and on the bottom we have IgG reactions. And this is our indoor reactivity panel. It's really useful when you're having chronic headaches or chronic congestion to see if there's something that you're interacting with on a daily basis, say in your bedroom or in your kitchen, that's kind of causing this ongoing low level exposure and consequent reaction. So again, here's the IgE is the more typical allergic symptoms, and here are these different mold spores, and then also house dust and other chemicals that you can interact with. And then on the bottom, we've got the IgG reactivity and with the same allergens. So these are two really great ways to look at the way that the immune system and the way our bodies are responding through different pathways. Our next is the food sensitivity report. So again, that's going to be usually an IgE related sensitivity or IgA. IgA is our mucosal immunity. So it's often what is being produced in the cells that line our respiratory mucosa and our GI mucosa. And with these food sensitivities, again, they're not causing the same level of reaction that we'll see with a typical histamine response, but they're adding inflammatory cytokines in our gut that adds to our systemic inflammatory load. All right, and then these are just some other tests that we'll often refer for. So we've got spirometry that'll tell us more about the type of pathology that's going on in someone's lungs. It gives us more information about your lung capacity and the ability of the lungs to expand and then also push air out in an effective way. We can also look at a chest x-ray. This is generally going to show us if there's any inflammation or fluid in the lungs, and we can look at it and tell whether it's viral or bacterial. And then the sinus CT is a really great tool for folks that have chronic sinus infections, and can tell us more specifically whether or not someone has a deviated septum or any obstruction that's preventing drainage of the sinuses, and also tells us about nasal polyps, which are growths in the nasal passages that happen as a result of long-term inflammation. And then lastly, we can do a sleep study. That's an outside referral for sleep apnea, where they observe you while you're sleeping throughout the night. And that gives us a sense of how often you're waking from that just lack of oxygenation.
Thanks, Dr. Mary. So this next section here is the meat of the presentation. This is where naturopathic medicine really shines, not just from a treatment perspective, but also from a preventative perspective, where we'll give you sort of 7 health hacks to think about how can we both treat these pathologies of the respiratory tree, but also prevent them from coming on so strongly. So health hack number 1 is diet. This comes back time and time again. And ultimately, when it comes to the respiratory tree and supporting it, it has to do with an individualized approach, which is patient specific, both depending on the patient's symptoms, but also what the pathology is, right? In general, we want to truly identify those food sensitivities and avoid them. In general, we want an anti-inflammatory diet, one that is alkalinizing, high antioxidants, high in veggies, high in the colors of the rainbow, ultimately. One that is low in tyramine and histamines, which we will talk about in the next slide. And then also a big key piece here is a diet that's low in added yeasts, including alcohol. Because remember, there's that cross reactivity, especially if someone is sensitive environmentally to molds with ingested yeasts, fungi, etc. So in order to eat a diet that's supportive for the respiratory tree, we've got to, first and foremost, reduce the allergens. So like Dr. Mary said, we can look at the food sensitivities. We can also look at the environmental allergies, suspected foods, that we'll try to remove are the ones that are high in histamines. Because remember, if you think back to that immunology slide, the histamines are those inflammatory mediators that lead to all of the allergy symptoms. Animal allergens from dairy, lots of connection with dairy ingestion being connected to congestion and chronic postnasal drip. So that's a pretty simple start if those are symptoms that you do experience. So when it comes to a low histamine diet, remember the histamine comes from those mast cells, which are a type of body cell, an immune cell that is dedicated to exactly this, to pumping out histamines. And usually it does this when it sees a parasite, okay? In this world, in this Western world, where we're not exposed to parasites very commonly, these mast cells get a little bit lazy and start to pump out histamines for the wrong reasons. And it leads to sort of chronic allergy symptoms, hay fever, asthma, etc. You could have histamine intolerance. It's a diagnosis we could make where it's just your body and your individual immune system is especially sensitive and has a buildup of excess histamines in the body, both from an internal perspective, but also an external perspective, since histamines are found in foods, okay? Almost all food and drink contain some level of histamine. And those levels increase as food ages, so think about leftovers, as food spoils or ferments. So if that is part of your picture, maybe fermented foods are not quite your friend. Going back down to this fourth bullet, there's a couple enzymes that break apart histamines that certain people have a genetic predisposition to making low amounts of these. Okay, they're called diamine oxidase, DAO, and HMNT. This is sort of going into genetics, but also potentially something we could test if we do go down that route. A low histamine diet is key here. So avoiding those foods that are naturally high in histamines, as well as the precursor molecule known as tyramine. And our next slide will have some examples. So again, foods high in histamine. Here's our slide if you want to refer back to it later, slide 26, where we talk about leftovers, fermented things, alcohol, especially aged cheeses. Down the list here are smoked foods, very high histamine content in smoked foods, canned foods, vinegars, citruses, etc., etc. So how do we combat these histamines, this histamine response that certain people have? Well, we've got to focus on our antihistamine superfoods. And these are the ones that contain actually enzymes that help with the breakdown of histamines. You see pineapple on the bottom there and papaya up top. These contain things, an enzyme known as bromelain, which sort of breaks down the histamines. And we'll talk about bromelain again in our supplement section. Another key piece when it comes to diet is just making sure that we are filtering by drinking enough water. So when you think of the lungs, this is something I realized in medical school in Gross Lab, is that the lungs are actually so heavy. They're full of liquid. They're full of something known as surfactant. Okay, so they need to be mobile and and you know, lubricated essentially. And water helps with that process. It helps filter things out from all of the excretion organs.
So speaking to that, our mucous membranes are going to require quite a bit of water too, and our lungs are tremendous organs of elimination, and we overlook them sometimes. When we're thinking about doing a cleanse or doing a detox, we forget how powerful respiration and the lungs are in that detoxification pathway. And speaking to that, our health hack number 2 has to do with our environmental management. What are your surroundings like? Are you surrounded to toxins, by toxins, or are you getting exposed to molds, maybe in your home or bathroom or workplace? What about allergens, either coming in internally in your foods or externally in your environment, or even dust and particulates that could be aggravating your mucous membranes, closing off that nasal breathing, impacting your sinuses, or even worse, damaging your lungs? So we want to be thinking about that. So take some time today and think about what your home air quality is like. Most of us spend a big chunk of our time sleeping. So think about your bedroom in particular. What is your bedroom like? Do you need to be thinking about getting some kind of filtration system that is in your bedroom, like specifically a HEPA filter or something like that? So when we have this time of year, we chose this respiration time or talk to be during spring because we wanted to make sure we touched on allergens, because this is the time where we start to get our pollens and this big release of these environmental allergens. It's important to mitigate those if we can. So we do want to try to reduce those. So yes, you can stay indoors on those days where there are higher pollen contents, or wear a mask. Thinking about what's going on with your whole house filtration, with your heating system, especially after the winter months, making sure you're changing those out, making sure you have a decent vacuum cleaner that has a nice filtration system on it. Thinking about laundering, of course, things like your pillowcases and your bedding, making sure that we're washing our hair. It makes a big impact when we get into the pollen season for people who have been outdoors and are sensitive to those kind of things. But the same thing is true if you're exposed to particulates, or if you're exposed to toxins through the workplace or something like that. We also can be using nasal lavage, which we're going to talk about more, as a way to rinse out those pollens and those particulates. And then think about pets. Like, are your pets jumping into your bed after they've been running through the lawn during those high pollen count days? Those kind of transfers can really make a big impact on people in regard to their respiration and their allergic reactions. And then don't forget the power of indoor plants. They can be very helpful for cleaning your air as well. So as long as they're not a flowering plant that's releasing pollen and aggravating you, it's very important as well for the clean air in your house. So thinking about, once again, the mold components, that's the other one, is finding it. We have patients who have been deeply impacted by mold that they didn't even know they were being exposed to. And it can be really challenging here in the Pacific Northwest because we have such a moist environment. Along those windowsills, we see it, of course, in bathrooms, it's a big one. Anywhere there's a moisture environment or an area with low airflow, so closets, certain vents, and then older cars are a big overlooked area as well. So getting your car professionally cleaned if you're concerned about mold for remediation is really important. And then having a remediating service that wears the right proper gear. It can be very dangerous to aggravate those mold spores if you don't have the right respiratory gear on.
All right. So next we're gonna dive into some herbal medicine for our respiratory tract. There's so many herbs that we can use for this. I've chosen my favorites to highlight. And in going through these, we'll go through a couple of different categories of herbs and how they work, their mechanisms, and general kind of ways we group these herbs together. So we'll talk about herbs for the common cold, herbs for allergies, and then also those for general lung support and the lower respiratory area. So that's kind of deeper in our lungs and bronchioles. So herbs for the common cold tend to be immune, either stimulating or modulating. So by stimulating, we mean we're activating our immune cells. By modulating, we mean we're helping our immune cells kind of get to a finer balance. So rather than really being strongly stimulating or suppressing our immune function, they're helping calibrate it so that it's working to act on the things that are important to act on. So elderberry is one of my favorite for preventing preventing colds during cold season. It's the Latin name is Sambucus nigra, and it's known to be antiviral, immune modulating, and antioxidant. So those bright purple, dark blue berries have those colorful antioxidant molecules in them that help kind of mitigate any of the damage that happens during these inflammatory reactions. Elderberry grows really well in the Pacific Northwest, and it's a really great herb to make syrups from. So you can, make a syrup using that and some honey and some other antimicrobial herbs. So that's a really fun one to play around with. We also have echinacea. You've probably heard of echinacea. It's one of the herbs that people use most commonly for preventing colds. And that herb specifically is most effective when you have the first sign of a cold. So often you'll have your throat feel scratchy, or you just start to feel tired, or maybe your lymph nodes get swollen. That's the time to use that herb specifically. And echinacea is known to activate natural killer cells. Those are what we consider the kind of marines of the immune system. So they're going in and kind of taking care of what other pathogens, and they're sort of like the first line of the immune system, and how it's responding. So in this way, echinacea is known to be antiviral, and again, most effective when you are first experiencing symptoms. All right. Our next herbs are Osha and Andrographis paniculata. So Osha is also known as Leucosticum purteri, and this one is a really, really interesting one. It grows in the Cascades, and this one is a diaphoretic, so it makes us sweat, which can be really helpful when you're first experiencing coming down with something. These ones that make you sweat get your circulation going and kind of help your immune cells get to where they need to go. Also has these strong antimicrobial properties, so killing any bacteria or viruses that are present. The Osha is often used in the form of a throat spray, so it can act directly on the microbes and when they're kind of starting to infiltrate the epithelium in the back of your throat. And again, this is also immune stimulating, so killing any pathogens and also helping our immune system get to those pathogens as well. And then Andrographis paniculata is a big Ayurvedic and Chinese medicine herb. It's one of our strongest antivirals, and it's, again, immune stimulating, similar to Osha. All right, so the next category is herbs for allergies, and typically these act by stabilizing mast cells. So we talked about those cells that release a ton of histamines and start the inflammatory cascade that cause our typical allergy symptoms. So that's what these herbs are doing. They're preventing that, that release of all of those histamines. And one of our main ones that we use for that purpose is called nettles, or Urtica dioica. You can find these in the woods around here. They're the ones that sting you. And the amazing thing about them is that they have a lot of quercetin. This is one molecule that that's often extracted for allergy control that Dr. Rosalie will talk about in a bit here. They also have a lot of potassium and calcium and iron and zinc, so great kind of nutritive herbs as well. Magnesium and some of these minerals can be really helpful when for asthma, when you're trying to reduce someone's reactivity. With nettles, you can make a nettle infusion. That's actually a cold infusion. It's the best way to do it, where you cover an ounce of nettles in a quart of water and just let it sit overnight and strain it the next day, and you have this really quercetin and mineral rich tea. All right, and then our last category here is herbs for the lower respiratory tract. This is when you think about either you're quitting smoking and need to help modulate your immune system and get some of that excess mucus and phlegm out of your lungs. It also is helpful with bronchitis. So, you know, when a cold gets deeper into your bronchi and bronchioles and lung area, and then also with cystic fibrosis, which is a chronic lung condition. So elecampane is a great one. This is one that is kind of a tonic for the lungs. So rather than taking it right when you get a cold, you're taking it to support your lung function in general. It's a mild expectorant, so that means it helps us cough things up out of our lungs and kind of breaks up the mucus. It also modulates our immune system again, so we want it calibrated, not too high or too low, and it's mildly antimicrobial. And then we also have Yerba Santa, one of our great herbs from California. And again, similar actions to elecampane, antimicrobial, inflammation modulating, and expectorant. These you would normally use in a tea or a tincture form. All right, now I'm going to hand it off to Dr. Rosalie to talk about supplements.
Thank you. Yeah, so this next section is where we sort of take what we know from the herbal botanical medicine and create supplements out of it. And so here at Prosper, we have an apothecary where we choose physician grade supplements. And we've got a carefully curated selection that is ultimately the supplements that we believe in that have the strongest sort of clinical data backing them. So when it comes to antihistamine support, we're thinking about, our antihistamine herbs. So instead of reaching for the Benadryl, there's a lot of supplements and plants and botanical medicine that can have a similar effect. So HLC Intensive here on the left is actually a probiotic mixture that has some clinical data showing that those probiotics actually help with the respiratory symptoms of allergies, curiously enough. Moving one over is our Quercetin Ascorbate. This is what Dr. Mary mentioned, and quercetin is an antioxidant, okay? So thinking back to our diet slides, something that's really helpful with allergies is those antioxidants. They scavenge the free radicals, they diminish inflammation. Allergy Plus, movement one supplement over, has some added, an even added boost to it, which involves a couple of herbs and that bromelain, okay, which is that anti-fibrotic enzyme. Okay, so if you think back a few slides, we talked about bromelain coming from papaya and pineapple, and it's a specific plant-based enzyme that pulls apart what are known as fibrosis. So when the lungs lose their elasticity, they become fibrotic. Okay, it's the same thing with the joints. When you're no longer really able to move your joint very well, there's fibrosis, there's adhesions. And so these formulas on the right here have that added bromelain piece to them. The Histamine is one that I use for my colder patients because it's sort of an Ayurvedic formula. There's an added herb in there known as Gaduchi, which kind of warms up the body and sort of scrapes the lungs, is how it's referred to in Ayurveda. So next class of supplements here are, our antifibrotics or fibrolytics, but also our bronchodilators. So these are the ones that are really helpful in asthma, okay, as well as COPD. Bronchodilator, it's in the name what it does. It dilates the bronchioles, so those separations of the lungs, so that we are able to better breathe and oxygenate. NAC here on the left is N-acetylcysteine. It's a precursor molecule to glutathione. Okay, and maybe you've heard of glutathione. It's a big detoxifying antioxidant, okay? And to have that one on board is really key. This is something I use quite commonly with my respiratory patients to both clear the mucus, but also help bronchodilate. There's that bromelain, yet again, our big enzyme for helping with fibrosis. Pulmonary Revive is a supplement that has actually mushrooms in it. So cordyceps is one of the big herbs in this one. And when we think about cordyceps, we think about immune modulating. So very helpful for asthma patients because their immune system is too ramped up, right? And we've got to modulate it so it's not creating all of that mucus and the wheezing, etc. And then lastly, our Bronchotone is our Ayurvedic supplement that has a bunch of antioxidants in it that is, again, scavenging those free radicals, greatly diminishing inflammation, helping those respiratory symptoms. Again, third category here, big lung herbs include our mucolytics. So again, that's in the name, mucus breaking, because if we've got excess mucus, we think of excess sputum, we think of postnasal drip, we think of a difficulty breathing deeply, right? Because the lungs are just full of other stuff besides air. So here's our NAC, it comes back yet again. Cough Soothe is a formula I use with my pediatric patients. It's an Ayurvedic formula that has a lot of herbs that are just generally supportive to the respiratory tract, as well as antimicrobial. Ginger tussin is a sort of cough syrup alternative that warms up the system. So if we've got a patient who's just quite cold and needs help sort of ramping their immune system to cough things out, ginger tussin is an excellent remedy. And then lastly, our homeopathic Drosera Plex, another sort of similar take on a similar theme here, but with that added helpful homeopathic, which is actually made from that plant that captures insects in its sticky sap. So it's kind of an interesting sort of energetic addition here. And then again, here's another just example of a mucolytic herbal supplement, and it contains our volatile oils, essentially, that come from eucalyptus, pine, peppermint, fenugreek. All of these have very, are very fragrant. Okay, it's in that fragrance that we have the medicinal constituents that help the respiratory tract. And this one specifically for breaking down excess mucus.
So our next health hack is going to actually be antimicrobials that are pretty specific for the nasal and sinus passages. And we put this one here because it really truly has been a game changer in our practice for our patients who are dealing with chronic respiratory difficulties that start right at the very beginning of respiration up in this upper airway. Now, when we're thinking about these, it's really important that we're working with a practitioner who can help do testing to make sure that we're choosing the right kind of antimicrobial. We have choices here that we can make as to whether or not we want to have compounded sprays that are made. And if we want to use certain antibiotics, a very common formula we use is the BEG formula, which is Bactroban, and which is mupirocin. Many of you have probably heard that. It's a very nice broad spectrum antimicrobial that's combined with gentamicin. These can be very helpful if we have incredibly resistant microbes that have set up shop in our upper airway system. Now, another one that we'll use quite a bit is colloidal silver, and we'll get that compounded from pharmacies as well for our patients. And the reason that we like that one is as very low risk of side effect, and it's incredibly broad spectrum. So it works as a great antimicrobial when we're worried about fungal issues, and it's a great antimicrobial for certain very resistant bacterial issues as well. So we wanted to put that one on there because there's so much power in treating sometimes with the proper antimicrobials if there is something that's really set up shop in the nasal sinuses, or even up in the deeper sinuses, like our frontal or sphenoid sinuses behind. So I'm going to switch over to Dr. Mary telling us about optimizing lung capacity here.
Hey, so yeah, like Dr. Molly just said, we'll talk about optimizing lung capacity. So you think about when you first start exercising, it's really easy to feel short of breath. So what's happening when you feel short of breath, and then what happens when after exercising for a few weeks you can run for a while and feel fine? This has to do with circulation and oxygen delivery to our tissues. So as we exercise, interestingly, we talk about increased lung capacity, but it's not that we're really expanding our lungs. We're actually increasing the density of the tiny blood vessels that surround the lungs. So at that alveoli lung interface where we're getting oxygen, we're able to get more oxygen into our blood vessels, and then we're able to circulate that through our tissues. And that is going to help us to kind of exercise for a long period of time without just feeling super short of breath and like our feet can't move, or like our legs are kind of made of lead, right? So that is what is happening when you start a new exercise routine, and it's good for your overall system to increase your oxygenation throughout your day. When you're actually exercising, that increased heart rate and increased circulation is again helping pump blood around and oxygenate your tissues in a different way. So a couple of different ways that that's really helpful. And then one thing to really think about when you're exercising and when you're increasing your lung capacity is breathing deep into your belly. That is going to allow you to compress your organs regularly. And when you're doing that, you're not stressing your muscles that help you breathe in your chest as much, which can kind of cause tension. And it's actually possible to breathe through your belly while engaging your abdomen. You actually even get more compression of your organs, which is helpful for blood flow there as well. So yeah, those are the amazing benefits of both diaphragmatic breathing and getting a regular exercise, high intensity routine going.
So our last health hack is breath practice, which is one of my absolute favorite topics when it comes to medicine, both naturopathic and Ayurvedic. But breath practice, you know, we breathe 25,000 times per day. So optimizing our breath practice is as important as getting exercise, sleep, nutrition, etc. Right? It's just something we commonly forget about in this Western world. Big tips with breath practice are just first and foremost, is reducing that mouth breathing. Okay, where we are relearning with the breath practice to breathe through the nose, from alternate nostril breathing to Buteyko type breathing. We can use nasal strips as well. Maybe you've seen these. They're just strips that go right along the bridge of the nose and bring those nostrils out to, again, help with getting oxygen through that route. If there's nasal deviation, it really impedes the nasal passages and the ability for oxygen to come in, for air to come in, to be warmed, and for optimal breathing to happen. So that's something that is very common that can be corrected and helps generally with breathing and thus downstream effects of the whole body responding to that. Number 2 here is decongesting the nose. Okay, again, breath practice comes into the picture here, where we're sort of moving things along by doing a specific breath practice. Physical movement, again, we're bringing our respiratory rate up, so we're clearing out the nose. And lastly, nasal lavage or neti pot is something that helps both mechanically to move any congestion in the sinuses out and clearing those nasal passages. The ways we do the breath practice there's many ultimately, but the big ones with a lot of research are the Buteyko style as well as Ayurvedic pranayama. So I wanted to put in this resource here for you. If you get a moment to pick up this book, it's written by a journalist. His name is James Nestor, and it talks through ultimately, he dives into research of how humans have evolved over the last century to breathe the way they breathe today, which includes all the pathologies that we mentioned, from sleep apnea to allergies to even dental concerns that are related to the change in human evolution to a specific type of face that contributes to difficulty breathing. So it's an interesting study of sorts. That's an easy read if you want to pick up that resource.
So going back to our nasal therapies, because we know how important it is to be breathing, initiating our breath through our mouth, we can use certain things like aromatherapy to help open up those airways. We can also be using steam inhalations, and you can combine some of that aromatherapy with the steam inhalations. We know from the research that just inhaling steam, say if you're in the shower, helps with opening up those upper airways. And it also helps with the lower airways with a bronchodilatory effect, which is pretty cool. So the addition of something simple like lavender, eucalyptus, or peppermint even in your shower can make a big difference with that steam, or doing an actual kind of a hooded maneuver with warm water where you put those oils right in and do a little covering with a towel or something like that to breathe that steam in. We also have a really cool technique available to us, which is a nasal lavage technique. And you can use a neti pot, which you can see the little picture of this woman demonstrating here, or even a nasal cup, which is right below. You can see that alcohol brand nasal cup that we like quite a bit as well. And the thought here is we want to open equally both sides of our nose so that we can enhance that respiration process. And we can do this by washing out those pathways with either salt and water. And we want to use clean water for that, of course. We don't want to introduce any infectious agents, or we can use a pre-made rinse. And there are several of those available. I really personally like the alcohol rinse because it uses several herbs and it's a very old formula with quite a bit of use behind it. So what we want to be doing when we're doing that is moving any particulates out of those nasal passages and reducing any mucus that might be up there blocking, but then also just helping initiate that clearance of those pathways so we can get proper respiration. So I wanted to just take a moment and go through a quick decongesting exercise with you, which comes from the Buteyko style breathing. And you guys can YouTube these to get more information about Buteyko or pranayama. As far as different breathing techniques, they're very powerful, in my opinion, can be really transformative for people for their overall health. But with this really basic practice, essentially what we're working on is we're working on using our nose, not our mouth, invoking the use of our diaphragm, that lower belly, and then going slower, not breathing quickly, and breathing in actually less air, which is kind of counterintuitive because a lot of times when people say, we want you to breathe really well, they say, take a big, deep breath. But for this style of breathing exercise, we actually want to restrict the amount of airflow that's coming in. And what this does is it causes this dilation, not only to the nasal passages, so you'll find that it's decongesting when you do it, but it also causes a better oxygenation, that push of that oxygen into the bloodstream. So you'll feel mentally clearer after doing it and have better cognitive function. So the way we do this is we just simply put our hand on our upper chest and then on our belly so we can feel that belly breath being involved. And we're going to go ahead and just breathe out our nose gently. And then we take your the hand on your upper chest and just gently pinch your nose to hold your breath. And you want to sway or nod your head to distract yourself for 30 to 60 seconds. And you actually want to invoke what's called breath hunger, or that feeling of sensation of wanting to breathe. So we do this for about that 30 or 60 seconds, and then we release our nose and we stay breathing only through our nose, not opening our mouth, and just gently breathe in slowly, not trying to add a whole bunch of air. So we're really just trying to restrict the amount of air that's coming in, and we repeat this 5 to 6 times. And as we're doing this, what we find is by the 5th or 6th times, if you have a side of your nose that's congested, that should clear. You also should feel warmer overall because it actually increases your body temperature to do this, enhancing that circulation. You should notice you have more saliva when you're doing it. This suppresses that sympathetic nervous system function, which often makes us feel more nervous, restricts our ability to think as clearly, and really helps us calm down. So we want to make sure that we're doing some of these breathing exercises through the day because that will help us by practicing that so that at night when we're unconsciously sleeping, we're not opening our mouth and breathing through our mouth as much. So doing these decongesting exercises can just be a really very simple tool, and doing them a few times a day can truly make a big difference for your neural feedback for what we need as far as a respiratory system. So I encourage you guys to give that a try today, and then a few times throughout the day if you can, and you'll get more effective at doing it and find that you can hold your breath for closer to that 1 minute period of time. Okay, so we're going to talk about Chinese medicine options and then Ayurvedic options, and thank you guys for sticking with us. We know we're going over our hour mark here.
All right, thank you, Dr. Molly. That was a great exercise. Okay, so now let's talk about traditional Chinese medicine. So we have this concept of the lung in traditional Chinese medicine. It is the kind of translation of this organ function within the Chinese medicine organ system. And the lung in Chinese medicine actually does include the nose, the mouth, and the are what we think of as the lungs in the Western sense, deeper in our chest. The function of the Chinese medicine lung is to generate qi, controls respiration, and it rules the exterior. So it helps prevent disease, which in the Chinese medicine concept comes from these invasions of these elements. So it prevents these elements from invading the body. Because it is the most exterior organ, it's the most vulnerable. So you can imagine with the common cold, for instance, it's the lung, including our nasal passages, is the first thing to get hit. So remember that when it comes to how disease is produced, in traditional Chinese medicine, these concepts were developed way before we had concepts of viruses and bacteria. So they had this concept that wind often carried disease and could carry with it different qualities like heat or cold. So those are kind of the causative factors in that system of things like the common cold, and we'll discuss that a little bit in the next slide. Another thing to think about in terms of what predisposes someone to disease in the Chinese medicine concept is not having enough qi. So qi is the animating force that protects the body and fuels all bodily functions. So when the lung qi is too low, that is going to make us more susceptible to getting colds more regularly. So next we're going to talk about some Chinese herbal formulas that are most commonly used for the common cold. And here I'm going to give you a sense of what I mean when I say a wind-cold invasion or a wind-heat invasion. Again, that's those external influences causing disease. We're going to talk about the ways that the common cold is conceptualized, so with those sort of that kind of terminology, and then how we treat it differently. So when it comes to these external influences or causes of disease, cold is much more likely to actually make you feel cold, and it causes this contraction. So you get body aches, headache, kind of feel averse to cold. And then with that syndrome, you often see a watery, loose sputum or mucus versus a wind heat invasion is going to cause that kind of feeling of burning sensation in your throat, a sore throat, and you'll feel hotter, more likely have a fever, and then it'll cause a yellow sticky sputum. That's another sign of heat. And then so there's two different goals with each of these. You want to, what we say, release the exterior. So that's kind of releasing the wind or whatever is causing the infection or the pathology. And then you want to either expel cold or clear heat. And so we have these two major formulas that are used at the onset of the start of a cold. So for the wind cold, so that headache, body aches, that watery sputum, the most common formula is Jingfeng by Dusan. And this one has much more warming herbs and herbs that cause sweating to warm you up and kind of get your circulation going. So ginger, licorice is in there, and a number of others that are more heating. Versus for the wind heat invasion, we're more likely going to use yin chow san, which is our major Chinese formula. It has about 15 different herbs in it, and the goal of that one is to clear heat. So it's got mint and chrysanthemum that help clear heat. And then there's some more soothing herbs in it to that have a mucilaginous texture that helps soothe the throat. So these are ways that we think about disease in the Chinese medicine model and how we treat it differently with different herbs.
Thanks for that Eastern perspective, Dr. Mary. Dr. Mary also does acupuncture here, so it's something that can additionally be added in for just general support of the respiratory tree. In terms of Ayurvedic medicine, which is traditional medicine from India, asthma, more specifically, can have 3 different types of root causes. So it can be due to kapha, which is our sort of earth and water elements. It could be due to pitta, which is fire, and it can also be due to vata, which is air and space. It very much depends on the symptom picture, whether asthma is kapha, pitta, or a vata type. So if you've got a lot of mucus, postnasal drip, chronic sputum production, think about a high kapha picture here. Remember, that's our earth and water elements. A diet that diminishes heavy, wet, cold foods, like our dairy and our cheeses, is going to be really helpful for that type of respiratory pathology. One of my favorite herbs for warming up the body, especially a kapha type picture, is pipali, which is a type of pepper. It's long pepper, and it's actually found in one of the formulas we mentioned earlier, the bronchotone. When it comes to managing pitta type respiratory symptoms, which is our fire, think of asthma, think of sudden asthma attack, wheezing, right? If we're trying to diminish that and prevent it, we need a diet that's low in spicy foods, hot foods, acidic foods, basically our histamine containing foods, right? So one of my favorite herbs for cooling down pitta is aloe gel. Okay, it's something that you can take just an ounce of in between your meals to really sort of calm down and cool down the system. Additionally, if we're managing vata, right, our chronic spastic type cough, non-productive, that's sort of our air and space elements have been increased. A diet that will help vata is one that's easy to digest, warming, simple, not complicated, an herb that is really helpful for the vata type person is an herbal mixture known as sitopaladi, which is warming. It has a little bit of honey in it and some heating spices, and it scrapes the lung tissues while also supporting it. And then lastly, again, this is a big sort of piece that sort of wraps up our doc talk today, is the breath practice, the pranayama, something we do daily to retrain the lungs how to breathe deeply into all of the lung bases. Alternate nostril breath is one you're perhaps familiar with if you've been to yoga class, where we sort of start breathing into one nostril and you breathe out to the other nostril. Again, we're just normalizing the nostril breathing, heating up the nose and closing that mouth again, preventing the mouth breathing.
So that concludes our respiratory tree doc talk today, but we want to invite you guys to our doc talk on April 12th, which is going to be all about fertility and ways to manage the menstrual cycles. If that pertains to you, we'd love to have you join us. And then we also just want to invite you, because we know we covered so many different things. If you feel like you have something going on with your respiration or your respiratory system, please let us know. I mean, especially if you're dealing with some kind of chronic blockage that needs to be assessed. It's just so very critical that we help address respiration and look at any root cause that might be getting in your way. So give us a call and we'll go through a nice assessment with you and figure out individually what's happening for you and really help you out. So thank you guys again for sharing a portion of your day here with us, and we look forward to next month. All right, take care.